It's time now for Morning Rounds. Joining us are CBS News Chief Medical Correspondent Dr. Jon LaPook and CBS News contributors Dr. Holly Phillips and Dr. David Agus. This morning, we're taking a look at a recent issue of the Journal of the American Medical Association devoted to critical issues in healthcare. A series of reports on costs and results from 1980 to 2011 revealed that the price of healthcare in the U.S. has climbed significantly, but many medical outcomes for patients are falling behind other developed countries. John, give us the headlines here.
Well, we spend $2.7 trillion every year on health care, okay? That's almost 18% of the gross domestic product, and that's a percentage that's doubled in the last 30 years. So we spend a lot of money.
We consistently hear the dollar amount we're spending, but it seems like we're no healthier for spending all that money.
No, actually, when you compare us to other developed countries, we really do not do very well. We spend more than twice per person on health care, and yet when you look at anything that you can measure, we're towards the bottom of the list. We have the highest infant mortality, the highest obesity rate, and we're second in terms of life expectancy at birth.
David, if the price keeps going up, why aren't we getting healthier?
Well, we're not focusing on prevention. Chronic diseases are overwhelming all of us. Things like diabetes and heart disease really drain the system.
When you look at where these dollars are going, though, it seems like it's going to a lot of young people. You'd think it would be going to older people. So why is that?
Well, it's one of the things that's really a paradox. But as we see now, more and more people are having these chronic diseases, and chronic diseases cost an enormous amount of money. We need to focus on prevention. We need to actually focus on ideas that can delay the onset of the diseases, and then we're going to have a big impact on health.
Holly, I want to talk to you a little bit about this recent report from the Commonwealth Fund, because in it they basically say a surprisingly high percentage of Americans don't go to the doctor when they need it, and they don't fill prescriptions because they simply can't afford it.
Yeah, that's right. Vanita, it showed that 37% of Americans go without recommended care, whether it's drugs, whether it's follow-up care with their physicians, or tests like radiology tests. 37% of Americans don't follow through with these things because of costs.
This is, when you put it all together, this is a pretty bleak picture. I mean, is Obamacare going to make any difference here?
Well, it could be a good first start, okay? If you have about 30 million Americans who, instead of using the emergency room as their doctor, are actually going to their doctor and getting that kind of care, that's going to be an improvement. But really, you're talking here about how do you pay for that, how do you get people insured, and really what you need to do is change the whole system and change the perverse incentives that we have that reward doctors for doing stuff to people instead of having social service, more integrated health care, and really looking at the big picture.
But how do you change the system?
Well, I actually think that that's one of the things that the Affordable Care Act is doing, is making change. I think to effectuate a big change, you have to start somewhere. And actually, that Commonwealth Fund study showed 75% of Americans really want to see health care totally overhauled. So even though the Affordable Care Act is by no means a perfect plan, it is a plan, and it represents a change, and then we can tweak it as we go along.
You get the sense that because this report was written by your colleagues, by other fellow doctors versus politicians, which is what we normally hear, this one will get more weight. Is that true? Do we look at doctors as being more?
Certainly this is an important step forward. Obamacare works on access to care, but we actually have to focus not just on healthcare finance, but on healthcare. So doctors are starting to speak up, and so are patients. We need to change the quality. One of the great things about the Affordable Care Act is it starts to cover all preventive care. And so there's no excuse now, because responsibility for health care is with each of us, with the individual. There's no excuse not to get that prevention. And we have to change the culture from a culture of dealing with disease to a culture of preventing disease.
There's an attempt to actually reward doctors, pay them a little bit more if they improve the health of their patients. And so you're going to see this more and more debated, because how do you actually measure quality of care? It can be tough.
I think it's also just a shift in focus from both healthcare providers and patients. There's a saying that we spend so much time mopping up the floor, no one thinks to turn off the faucet itself.
Right.
And I think when we focus on that faucet, that's really going to make us look at prevention, and it really will overhaul our healthcare system.
How do you incentivize prevention? I mean, you reward doctors. Is there another way to do it?
Well, I mean, one of the things the Affordable Care Act does is it says you could differentially charge health insurance based on behavior. So if you smoke or you're obese, you can charge them differently than if they don't.
I'll tell you one example that always jumped out at me, which was that Medicare in the old days, or insurance companies, wouldn't pay for a podiatrist, say $150, to look at the foot of a person with diabetes. Instead, they will pay for $20,000 to amputate that foot months and years down the line when you haven't done the prevention.
I also think the Affordable Care Act, it's ideally it's going to provide some more funds for public health measures, for getting messages out about how to eat well, how to exercise, what we need to do to really prevent illness. And I think just getting that message out and having people focus on that will make a big difference.
I guess the bottom line is this is Obamacare 1.0, and there's certainly going to be 2.0, or it needs to be 3.0 and 4.0, and it's a beginning, and then we'll see how we react and
Well, for all,
change things.
for all the negative controversy, it has at least started a dialogue. People are now saying, how can we look ahead as opposed to responding?
No question. But there are glimmers of hope, right? New York City had a healthcare leader and had a mayor who said, if I start to change things, what will happen to the health of the city? And what do you know? Rich or poor, large or small, health got better. Hopefully that leadership can work on a more national level.
But what you're all saying, it seems to me, is that we need to change the way we're thinking about this, like top to bottom.
Top to bottom, we have to make it so that the whole environment is healthier, and we just trip over healthy behavior. We don't say, how can we go out and do this or that? The whole community is thinking about how to make all of us healthier.
We also have a good blueprint from some other countries. Dr. Jon LaPook, Dr. Holly Phillips, Dr. David Agus, thank you guys so much for joining us.